Hello everyone, welcome back to my YouTube channel where your health matters with Elizabeth. Where we give you tips on how to take care of your health, where we talk about eat diseases and how you can manage it with what you eat, and that is your diet. Last week we looked at what hepatitis is all about, the types of hepatitis, the causes. We look at the viral types of hepatitis, which is caused by viruses. That is the hepatitis A, B, C, D, and E, the causes, the symptoms. And we promise that this week we'll be looking at what non-viral hepatitis is all about and how we can use our diet to manage hepatitis. So stay tuned and follow me. Let's educate ourselves together, and I believe we learn one or two from this video. Thank you. I guess take us through what hepatitis, the viral types of hepatitis, A, B, C, D, and E, and also tell us the causes and the symptoms. Like I promised, I'm talking about the non-viral hepatitis today and how we can manage hepatitis through a diet. The non-viral hepatitis, like the name implies, it means the type of hepatitis that are not caused by any virus. It's either caused by our day-to-day activities and an underlying disease or medication. We have the alcoholic hepatitis, we have the autoimmune disease hepatitis, and we also have the drug-induced hepatitis, the metabolic disorder hepatitis, and the ischemic hepatitis. Alcoholic hepatitis is the type of hepatitis that is liver inflammation that is caused through excessive intake of alcohol or the prolonged consumption of alcohol. This alcohol tends to damage our liver, leading to inflammation, and in severe cases can lead to scarring of the liver called cirrhosis. The only treatment that are available for alcoholic hepatitis is abstinence from alcohol. Like if you can stay completely off from alcohol, it can be treated. It is reversible. So when you abstain totally from alcohol, the alcoholic hepatitis, the inflammation that is caused through the alcohol can tend to come back to normal. But it's still mostly manageable if you can stay absolutely stay off alcohol and through supportive care. Autoimmune hepatitis. Autoimmune hepatitis is the type of hepatitis that is caused by body immune system mistakenly attacking the liver cells, and it can lead to liver inflammation and damage of the liver. The exact cause of this autoimmune hepatitis is unknown, but it is believed that it's a combination of genetics and environmental factors. It's predominant in women. Affected the most is women, and it often require long-term management with immunosuppressive medication. It can only be managed through immunosuppressive medication. The drug-induced hepatitis is caused by some certain medication, toxin, or some upper supplements, which lead to liver inflammation and damages. This type of hepatitis can occur as a result of adverse reactions to medication or as a result of overdosing on this certain type of medication. The common medication that are actually associated with this drug-induced hepatitis, they are known as NSAIDs, the non-steroidal anti-inflammatory drugs, acetaminophen, that is paracetamol, excessive intake of paracetamol, taking more than the normal dosage that is supposed to take, it can lead to liver damage, and some antibiotics, anticonvulsants, and some herbal supplements. You know that herbal supplements, most of them does not have dosage. So taking more than what you're supposed to take, you can make your liver works beyond how it's supposed to work, can lead to the damage of the liver. The treatment for this type of hepatitis is just for you to identify the type of medication that causes the liver damage and discontinue the medication. Also, with supportive care, it can be treated. It can tend to treat this type of hepatitis. Metabolic disorder. Certain metabolic disorder can lead to hepatic inflammation and liver damage. Some examples of this metabolic disorder is known as mucin diseases, which is characterized by the abnormal copper metabolism and alpha-1 antitrypsin deficiency, where there is a deficiency of a protein that protects the liver. The treatment for this metabolic disorder is managing the underlying condition, and in some cases, it can be managed through the intervention of some medication. Ischemic hepatitis is also known as shock liver, or it occurs due to inadequate blood supply to the liver. Typically, it is caused by severe low blood pressure or reduced blood flow. It can be a complication of conditions such as heart failure, severe infection, or excessive surgery. The treatment for this type of hepatitis is addressing the underlying causes and providing the necessary supportive care to optimize the liver function. What happens when hepatitis is left untreated? It can lead to various health conditions and complications like liver damage. The outcome of this depends on whether it is acute or chronic and type of the hepatitis. Liver damage. Hepatitis can cause inflammation in the liver, which, if left untreated, can progress to more severe liver damage. Chronic inflammation can lead to liver fibrosis, that is scarring of the liver, and cirrhosis, a condition in which healthy liver tissue is replaced by scar tissue. Cirrhosis impairs liver function and can eventually result in liver failure. So when you leave your hepatitis untreated, it can lead to liver damage. It can also lead to liver cancer. But the type of hepatitis that mostly affects it, that can lead to this liver cancer, is the chronic hepatitis B or C infection, particularly if it progresses to cirrhosis. It increases the risk of developing liver cancer, that is hepatoma. Long-term untreated hepatitis can lead to the development of liver tumors and significantly increase the risk of cancer-related complications. Leaving hepatitis untreated can also lead to extrahepatic manifestation. Some viral hepatitis like hepatitis B and C, which are the most common, can cause extrahepatic manifestation affecting organs and tissue outside the liver. It can lead to kidney disorders, joint inflammation, and some autoimmune condition. Also, untreated hepatitis can be transmitted to another person, either through blood contact, sexual contact, or other measure like bodily fluid contact, like having a contact with somebody that have hepatitis. If the person is sweating and you have a contact with that person's sweat, you can contract hepatitis through that. Also, it can also lead to complication during childbirth. A woman with untreated hepatitis can transmit it to their child during childbirth. It can also increase the risk of developing liver disease, liver cancer, and other related complications. How do we prevent hepatitis? Early diagnosis can help to get the necessary treatment for hepatitis. If you were able to diagnose hepatitis on time, you'll be able to treat it on time. So it helps to lower the progression of hepatitis. When you treat it on time, it slows down the progression of hepatitis. So that's why you say get tested. Know your hepatitis status. Once you know your hepatitis status, it will be easy to start treatment on time. Another measure to prevent hepatitis through regular monitoring, early diagnosis, lifestyle modification, antiviral medication. The most effective prevention is through vaccination. So know your hepatitis status, get vaccinated. Vaccination is very safe. It's one of the safest measures to treat hepatitis. Looking at how we can manage this hepatitis through our diet, through what we eat. Any disease can be managed through healthy diet. Eating healthy is very paramount in treating any disease, in managing anything. Managing our health, we have to eat healthy. You eat plenty of vegetables and fruits, eat more of nuts, eat plenty of cereals, preferably bread, rice, pasta, all those, preferably whole grains. Include lean meat, poultry, fish into your diet. Lean meat are the skinniest type of meat. Your goat meat is very important. Your red meat is also very important. Milk, yogurt, cheese, they are important to your diet. You drink plenty of water. You avoid high saturated fats. Instead of going for high saturated fats, you go for healthy options like nuts, your butter, your avocado, and other oils. And your fish, you can eat fish, but go for the fish that have more of omega-3 fatty acid in them. Abstain totally from alcohol. Also limit foods and drinks that contain salt. High salt intake is not advisable when you're suffering from hepatitis. Dairy foods are a great source of calcium, so you opt for dairy food like yogurt, your milk. They are very important. You consume only moderate amount of sugar and foods. Like food containing added sugar, you consume moderate amount of it. You don't just eat anything that has sugar. Don't just eat it anyhow. Limit your sugar intake, limit your salt intake. Drink plenty of water, at least three cups of water per day. I keep saying avoid alcohol. Alcohol is not your body friend. Like it's not a friend to your liver, because increase the risk of developing liver failure, liver cancer, cirrhosis, and all. Also avoid raw fish. Take fish, but don't take raw fish. Raw fish like sushi, you avoid it because it can lead to raw fish. It can lead to foodborne diseases. It can increase the risk of contaminating foodborne diseases. Also avoid liver. Liver is high in iron. Your liver doesn't really need too much of iron. Your liver doesn't need that liver. It doesn't need the iron. So you avoid the consumption of that liver. It can cause enlarged liver failure, liver cancer, or cirrhosis. I believe so far you've learned one or two from my video, both the last week where we talk about hepatitis, the types of hepatitis, hepatitis A, B, C, D, and E, the symptoms, the causes, and also today when we talk about the non-viral hepatitis, the alcoholic hepatitis, the autoimmune hepatitis, how we can prevent hepatitis, how we can also treat hepatitis through what we eat. So please don't forget to subscribe, like, share, comments. Any question you have, you can send it through the comment section. And also please share. Your subscription is important, so your like, your comments, they are also very important. Thank you. See you next time. This is where your health matters with Elizabeth. Thank you. Bye.